Hello, dental assisting students. I'm going to give you a tutorial on how to use the Perio charting in Fuse. So when you'll have to actually use this application is when you're in the dental hygiene clinic with the dental hygiene students. They might ask you to do some Perio charting for them. So in Fuse, they will have their patient up. So we would go to patients. And if it's a live patient today, we're going to do it on a Dexter since, we are just practicing, but they would have their patient information, their dashboard up. Once you're on the patient screen, up at the top here under clinical, it'll be Perio. You will click on that and it brings you to a Perio chart. This specific Dexter or patient does not have any Perio charts, so we would start a new exam for this patient. Now it looks like a lot of blocks to fill in, but I promise you it goes pretty quick. This here is their periodontal charting. So it's every tooth, and every tooth has 6 surfaces of the tooth that can be charted. And we take a lot of different information. So just to start off with, it starts from tooth number 1, and you can see that they're labeled up here, all the tooth numbers 1 through 16. And then you jump to the bottom and it's 17 through 32. So depending if they are missing some teeth, the hygiene student will already have removed them in the dental charting and they won't let you perio chart them, say if they don't have the wisdom teeth. Some surfaces to look for. So now the top 1 through 16, here it'll tell you these top numbers are the buccal and this bottom row here are the lingual. PD stands for periodontal depth. So when the student is measuring, they measure with a perio probe. 1 through 3 is healthy. 4 tends to be our warning sign, a little bit of inflammation. 5 or more is telling us there's a lot of inflammation or bone loss in the area. With the perio chart, the dentist or the hygienist would also use the radiographs to determine if it was bone loss or inflammation. And that's how you would get a periodontal health diagnosis. So a lot of times the student or the dentist will start off with the periodontal depths. Then they will go to GM, which stands for gingival margin. That's recession. So that's how much gum tissue is missing from the CEJ or the cervical enamel junction up to the gingiva. So this is showing us some root surface, right? So there are some reasons why you can get recession, whether it be from brushing too hard or aggressively using a medium or um, uh, a medium or hard bristled brush. Clenching and grinding can do this. Trauma to the teeth can do this. There are quite a few reasons why you can get some recession. But we want to mark those or measure those because if they start to increase, we say, hey, what's going on? What's the underlying cause? Why is this happening right now? And it means that there is support of the tooth disappearing. CAL stands for clinical attachment level. So it will take, and I won't go into the math of it, but it'll take the periodontal depths and the gingival margin and the information here, MGJ, which is mucogingival junction. So how much free gingiva you have there. And it'll give you how much clinical attachment level is. Again, this will guide the hygienist or the dentist into determining with the radiographs if there is periodontal disease. MOB stands for mobility. So if the tooth has mobility, we'll talk more about it, but it could be in classification. So class 1 is a little bit of movement in the tooth. Class 2 is a little bit of movement in the tooth and maybe some back and forth and forward and backward movement. Class 3 mobility is there's movement, a lot of movement in the tooth, forward and backwards, and even depressible. And class 4, it's barely hanging on by a thread. But we typically use classifications 1, 2, and 3 for mobility. And FG stands for furcation. So some of these teeth, the posterior teeth, have a furcation, right, where the root splits. And sometimes there's recession or sometimes there's bone loss where then you can now measure inside the furcation. We use a special probe for that. And when they go in, it's whether they can put the probe into the furcation a little bit, halfway through, or if the probe goes all the way through the furcation. So they might give you some numbers to chart there. They'll start off with another important uh, another important charting that needs to be done is bleeding, right? So if you click it, the tooth surface has three surfaces here. If you click once, it'll go red to bleeding. You can also hit B on the keyboard and it'll go into bleeding. If you click it twice, it'll turn yellow. That means suppuration, which is pus coming out, right? So if there's infection, you probe into it and there's pus, you kind of want to signal that, hey, there's something going on there. And if you click it 3 times and it is red with a yellow halo, that means it's bleeding and there's pus into that area. So when they're measuring, they're taking 3 measurements from the buccal and 3 periodontal measurements from the lingual, and they're walking the probe all the way around. So they're just going to give you 3 numbers. They might be doing a lot more with that probe, but they're going to give you 3 numbers. So, to start off, we'll make sure PD, if we're doing periodontal depth, they always start on the upper right-hand side, and they go straight across. So they might say 3, 2, 3, 3, 2, 3, 3, 2, 4, whatever the numbers are. See how the 4s are lighting up? That is because anything more than a 4 millimeter pocket may indicate infection, and so it'll light up red so we don't miss it. Typically, we see 3s and 2s in posteriors. A lot of times we'll see 1s and 2s in anteriors in healthy gingiva. After they go through the periodontal depth, so it took us all the way across 1 to 16 and then went lingual on 16 and all the way back to 1. It'll do the same for the mandible. It'll go from 32 to 17 on the buccal. You'll go across inputting their numbers, and then it goes 17 back to 32 on the lingual. After they do the periodontal numbers, they will then give you the gingival margin. So the gingival margin will have 3 numbers, but the only numbers they might give you is 1 on the buccal surface. If the tooth has recession and has direct access to the mesial or distal, then we can record it. So say there is tooth number 2 in the mouth, but 3 is missing and 1 is missing. You might find recession on that mesial aspect and you would put it in there, or the distal aspect, right? So that means mesial, facial, distal on these numbers. But for the most part, teeth don't appear to have recession on the interproximal, so we will just be putting the recession number that they give you, and they give you the highest recession number right in the center bubble. So if there's 4 millimeters of recession, you would highlight the middle bubble, put in the number of recession that they are giving you, and then it's going to change that CAL, that clinical attachment level. You could see automatically it's telling them what that clinical attachment level is. MGJ, some of the students will do, especially for 24-25, if they're missing tissue, that MGJ category might go in. A lot of folks might not be using that. And mobility for sure. They'll be going in and checking the mobility. You click on the box and you put in the stage of mobility that you can do it. As you see, I'm doing that right across. In the box over here on the right-hand side, it's giving you the tooth and then all the information. So say you were doing 1 tooth at a time, all of the information, you could just put them into the boxes here, and it would populate it onto your full chart over here. And you can toggle from tooth to tooth. But for the most part, you can click on whatever you're doing, periodontal depth, and it'll go right across. So that is the Perio chart. I want to make sure that you are saving in the upper right-hand side pretty consistently. It's like a computer. You do not want to lose any of your information. So after you save it, if you change it, if you changed a number or added it, you can save it again. It's not going to disrupt anything. And when you're done finishing with the perio chart, you need to hit finish and it'll save the whole perio chart for that patient. Perio charting is done about once a year on healthy individuals and once a year for everybody. If they have had a history of periodontal disease, they might be perio charting at every appointment, so every 3 or 6 month appointment. So that is kind of the nuts and bolts of the perio chart. If you have any questions, you can always come to me or ask any of the other faculty.